and welcome to everybody. Thank you very, very much for joining us today. Amy and I are going to be talking to you about being neurodivergent in higher education. So if you just give me a second, I will share my screen with you.
There's still a few people coming in as we speak, Emily, as well, so it might be worth waiting just a few seconds for the participants.
Not a problem at all. Not a problem at all. Yeah, I can see that the number of participants are increasing, so we'll just give it a couple of seconds. But hopefully you should all be able to see the screen now. Right, should we get going? And
yeah, I think that seems to have settled now, so
perfect. We'll let people join slowly and trickle in. We'll just start with introductions. Okay, so welcome to this live lecture today on being neurodivergent in higher education. I thought that we would just start briefly by introducing ourselves. So my name is Emily Edwards. I am a midwifery lecturer at Middlesex University. And as an autistic healthcare professional and lecturer, I have a real passion for the topic, and I wish to be a really strong advocate and role model for neurodivergent students. As some of you might know, the ONS has published data showing that only 22% of autistic adults are employed. So for me, that's a very, very striking statistic. And personally, as a child, a student, and as a professional, I encountered numerous barriers in my environment, and I often wished that I had a role model. So that's one of the reasons that I talk about this topic quite a lot. And I'm really, really fortunate to be able to work with a hugely diverse student body. And I'm really eager to ensure that neurodivergent students' learning needs are understood so that they can thrive at university. I'll just hand you over to Amy.
So I'm Amy Richmond. I'm one of the midwifery lecturers here at Middlesex University. My background as a midwife, I've worked as a rotational midwife before spending many years in community before coming into education. One of my passions around neurodiversity is dyslexia. One of the focuses of my master's study for my dissertation was about dyslexia in midwifery, with a particular focus on how best to support students in midwifery practice settings. That stems off the back of personal experience, having a husband with dyslexia and experiencing some of the difficulties that he has experienced in his sort of adult life, and particularly within his career. He went into higher education as an adult and has since been successful in becoming a professionally qualified electrician. So I've been able to experience some of his difficulties as well, and hence one of the passions I have going forward, in able to support midwives and other professionals.
So moving on from introductions, what are we going to be talking about today? So the content of this live lecture is to address the first question: what is neurodiversity? So some of you might well know and have a definition that you kind of agree with or that you like, and others of you might not really know what neurodiversity is. So the first question is, what is neurodiversity? Then we'll look at neurodiversity in higher education. And then we'll also go on to look at some recommendations. So first of all, what is neurodiversity? So neurodiversity is a term that was coined by Judy Singer in 1998, and it simply means diversity of the mind. So it's the idea that there are variations in the human genome that result in neurodevelopmental differences, such as autism, ADHD, dyslexia, dyscalculia, dyspraxia, Tourette's syndrome, and I'm sure that there are others that I haven't named, but that's just to name a few. And I think that the reasoning that there might be a normal or a correct way of neurocognitive functioning is no more logical really than the idea that there's one normal or correct gender, race, or culture. So it's very acceptable to think that there would be a wide range of neurodevelopmental differences. Something that I wanted to focus on was the medical versus the social model of disability. Now, the medical model of disability has long categorized neurodevelopmental differences as disorders and deficits. So somebody who's missing something, that's how the medical model of disability categorizes these differences. And whilst we recognize that neurodiversity contains huge heterogeneity, the medical model reveals cultural prejudice and leads to oppression for those who are labeled in this way. And it ultimately asserts that neurodivergent people are always impaired by their disabilities. Instead, neurodiversity and the neurodiversity paradigm roots itself in the social model of disability. And that asserts that neurodivergent people are actually disabled by barriers in society. And a little bit later on, we'll talk about what some of these barriers might be. The social dynamics that surround neurodiversity can be compared to the dynamics that manifest around other types of human diversity. And those include things like an unequal distribution of social power or job insecurity and a lack of accessibility. The social model of neurodiversity also encourages identity-first language. So a lot of people will prefer terms such as autistic person or dyslexic person rather than something like person first language, which would be something like a person with autism or a person with dyslexia. So a lot of us prefer identity first language. So that's quite an important thing to think about. And I think it's really, really important to note that when diversity is embraced, it can really act as a source of creative potential. Because rather than looking at the barriers, I think that we can often look at the strengths. And I think, although as a society, we must recognize the barriers faced by neurodivergent people and we have to dismantle them, we have to also ensure that they're able to live and thrive in environments that embrace their natural neurological dispositions. And I think that that's also true for student nurses and midwives. And unfortunately, the true numbers of neurodivergent students are unknown. We still need to do a lot of research in that area. And that's particularly due to an underdiagnosis in women and also the phenomenon of non-disclosure. So non-disclosure is when people don't actually disclose the fact that they might have a form of neurodiversity. So it is clear that from student experience, sometimes the learning and working conditions aren't optimal. And this is something that Amy and I are very passionately working on. So moving forwards, neurodiversity in higher education. So we wanted to do a little kind of quiz or something collaborative with you all. Unfortunately, we can't see you, but you are very, very welcome moving forwards to put any questions that you might have in the Q&A. And of course, at the end of all of this, we will be absolutely happy to answer any questions that you might have. But in the meantime, I thought we'd do a little bit of a quiz. So if you've all got your phones nearby, what you can do is you can just type into Google or whatever you know, Firefox or Mozilla or whatever you're using, just type in vvox.app and that should take you to a page where you should be able to put in a session ID. Okay, so you should come to a landing page and it will say enter session ID. So if you put in 112, then 544819, that's the session ID, and just press on join session. And we'll do just a very quick quiz just to see, or not so much a quiz, just to see what why you're all here really. So my first question is, what is your primary reason for attending today? So I'll just give you a little bit of time to put in some responses and just let me know what was your interest in coming to listen to this session today. So I can see that we're starting to have some responses. And I'll just give you a few more moments to answer. So for those of you who've just joined, you can go to vvox.app. It's in the top right-hand corner here, vvox.app, and there's an ID here, 112-544-819, and you can put in some answers as to why you're here today. Okay, so let's just see what some of these answers might be. So this will create like a small word cloud. Okay, so I'm neurodivergent. Will I cope at uni? I want information, curious about the topic. Okay, so I think one of the things that stands out to me is, will I cope at uni? And the answer to that is, obviously we need to look at things on an individual level. And we're going to talk a little bit more moving forward. So I think this is if that was your question, I think that this is going to be a really good presentation for you, because we're going to talk about the kinds of things that you can do to make sure that you do really, really well at uni, that you don't just cope, but that you thrive, because that's really, really important. I want information. Well, you're going to get plenty of information, hopefully, by the end of this session. And hopefully we'll be able to give you a lot more information about the topic. So then I've got...
We do have a question in the Q&A box as well, Emily. Just saying, I think
that's it's an answer, I think, to this primary reason, to help get the understanding of neurodiversity in higher education before you start uni. Yeah. Okay, well, I think you're definitely in the right place. Okay, so moving forwards, I'm going to ask you now another question. Do you identify as neurodivergent? So this should come up on your VVox. So it's very simple, yes or no. Do you identify as being neurodivergent? Okay, so we've got quite a number of responses here. Okay, so I'll just close that poll. And you'll see come up on the screen. So 27% of you do identify as being neurodivergent and 72% of you do not. So that's really interesting, actually. It's interesting that there's lots of students who've come to find out more, despite the fact that they're not actually neurodivergent. So that's really great, because I think it's good to make sure that lots of people know about this and know about the topic and are interested in the topic.
Absolutely.
So the final question is, what form, for those of you who do identify as neurodivergent, what form of neurodiversity do you have? And I think that that will also be interesting to see, you know, what different types of neurodiversity we might encounter.
I'm not sure that's yet coming up, Emily.
I've got responses coming in.
Yeah, is
it coming in?
Yeah.
Great. I'll just leave a couple more seconds. Okay, so let's have a look what's coming up. So language disorder, ADHD, ASC, dyslexia, dyspraxia, So as we can see, we've got a really wide range of neurodiversity amongst us. And I think that will be the case in all of your courses that you might join. You know, you'll have a real diversity of people on your courses, and there'll be a real diversity within the neurospace as well. Okay, so, oh, I'll just move forwards again. Okay, so over to you, Amy.
Thank you, Emily. Yeah, so just in terms of looking at statistics, obviously, as we've identified, there's a wide range of different neurodiversities that we can look at, but just obviously from our own personal interest, just to give you an idea of some of the statistics here. So dyslexia, we know that 10% of the population as a whole are dyslexic, and it's believed that that would be quite true of representation of our students as well. It's very difficult to give an exact amount because from research that I've done during my master's in higher education, I was very apparent that although we were very much aware of some students and their diagnosis of dyslexia, we're also aware that there are many barriers to disclosure as well, which we're going to look at in a little bit more detail. But we understand about 10% of our students are thought to be dyslexic, and of those 10%, an incredible 40% of those students are actually not diagnosed until higher education level. There may be many reasons for that. We know that Emily and I were talking earlier that actually we're very much better at raising awareness of different neurodiversities now, and actually more and more adults are coming through and being diagnosed later in life, and it's maybe not until they reach university level or other higher education institutes that they will think to or be encouraged to or feel able to actually get that diagnosis. Emily, did you want to talk about the statistics?
So when it comes to autism, there are kind of new statistics recently that have come out. It used to be thought that about 1 in 100 people would have autism, but the most recent statistics show that it would be closer to 1 in 57 people. So that's quite a high percentage of people who would be autistic. And what we need to recognise is this is particularly underdiagnosed, especially in women. And current research hasn't precisely identified the rates of autism within higher education, but what we do know is that there's been a really sharp increase in the prevalence of neurodivergent conditions in UK schools between 2010 and 2019, and that means that ultimately there's an increasing number of neurodivergent students who are progressing on to higher education. But it's really, really important to note that these percentages are likely to be a lower estimate, and that's mainly due to students maybe not choosing to share their diagnosis with their university. And that's a bit of a shame, really, because it means that ultimately some of these students might not be getting the support that they rightly deserve and need. So that's something to think about. And I think awareness has really changed over the past couple of decades, and that students feel more and more supported to be able to disclose at university and to get the support that they need. So we've talked a lot about disclosure, but I'll hand you back over to Amy to tell you a little bit more about it.
So when we talk about disclosure, we're thinking about what that actually means. And I think disclosure presents itself in many different forms. There may be an official disclosure sort of via official routes. So for instance, those 40% that we just looked at that have been diagnosed at university, will tell you more about how you can go about doing that if that's something you need to do as we go through the session. But there may be an official disclosure through that route, or it may be more of a disclosure to somebody close to you, such as a peer or family member. It may be disclosure to somebody that you feel may be able to support you quite closely, such as a tutor or a mentor in practice. There are many barriers to disclosure. So, for example, the study that I did looked at a small cohort of, small case study of students, student midwives, particularly in their experiences in practice. And it became apparent that a lot of the barriers to them feeling able to disclose were things like fear of stigma around their neurodiversity. There may be not feeling able to disclose in terms of actually feeling comfortable to have those conversations, and not feeling that they may necessarily be supported. So not feeling that people were maybe aware of how to support them with any challenges that they may be facing. So we know that actually, as Emily said, there's a lot of benefits to actually having that disclosure, and particularly in able to put support in place, should I say, and being able to look at the individual and actually being able to work out ways to overcome difficulties, and actually, as well as overcoming difficulties, being able to play to that individual's strengths as well, because we do know that actually there's a lot of strengths that come from the different neurodiversities that we're surrounded by, and it basically enables us from a university perspective to be able to put reasonable adjustments in place as quickly as possible. And that's one of the things that I would say going forward. If that is something that you feel you're going to be coming to university and you're going to need support with, the sooner you can get the ball rolling with that, the better it will be, because those reasonable adjustments can be put into place sooner rather than later, which is going to be a key factor really in able to ensure you succeed. And yeah, being open to disclosure and actually having that in place, you'll find that you may find support networks through the university as well, and we'll tell you more about that later in the session as well. Okay, next slide. Thank you. So in terms of coping strategies, so we're looking at this very much from both positive and negative aspects, because as I've already highlighted, different neurodiversities aren't necessarily a negative thing. They come with a lot of positive aspects as well. So we'll look at some of the different factors here. So hiding and masking, this may be something that Emily, you might want to add a little bit more in as well, but it's certainly something that many of the students that I interviewed suggested that they started to do. So they may try and hide their dyslexia, for example, from others, because they don't want to necessarily come across that they're not able to do the role that they're trying to do. They may try and mask different traits that they may have in order to try and fit into the environment. And Emily, you might want to jump in here and explain a little bit more about the masking.
Yeah, so in autism, masking is something that's talked about quite a lot, and it's particularly something that a lot of autistic girls and women associate themselves with. And often masking is a way of feeling like you are able to fit in a little bit more closely into the environments that you're evolving in. Now, the thing is with masking is, for some people, it's a real coping mechanism, and it's something that they feel that they need, that they have to do. But equally, it's something that's very draining, and it's very, very energy consuming. So it can lead to things like autistic meltdown or autistic burnout. So it's something to be very considerate of, because if you're having to do, if you're having to mask day in, day out and prevent behaviours like stimming or other behaviours that might be linked to autistic coping mechanisms, then that can be a really, really tiring thing to have to do. So it can be both a positive and a negative aspect of if you're kind of coping strategies that you've put in place.
Mm-hmm. So again, this key word here, asking for support, easier said than done, and it's maybe knowing who the right person is to actually ask for support and able to deal with the different things that you may face during university life. So we know that, for example, if we're looking at support with theory work, then the best person to support you with that may be an academic tutor. It may be support from library staff or learning enhancement team at the university. If it's something to do with practical skills within the practice setting, it may be supervisor that you're working with, or what we have in many of the trusts that we work with are people called clinical practice facilitators, who work very closely with students and will be able to put support in place where is needed. Oh, sorry, Emily, can you just go back one slide? That's it. So hypervigilance. Hypervigilance is something some students may use in order to cope with some of the challenges that they face. So, for example, some dyslexic students, if we know that in healthcare there's a lot of documentation, for example, that is a theme that they will find particularly challenging, and some areas of practice they may be faced with this more than others, and find it more challenging in others, for example, with short time frames in order to complete that. So what some students have reported, that they may actually kind of take that bit more time to understand particular documentation technologies or different forms and different documentation sheets that they may be faced with, for example. So hypervigilance was a theme that sort of came out of that. The use of technology is ever evolving, and there's more and more technology available now in order to support students in various different ways. Next slide, please. Thank you. So some of those assistive technologies, so we've got things like visual aids, which may be sort of aids which some students may keep close by, sort of pocket-sized aids such as flashcards and sort of succinct information sheets that they can refer to in a way that they can understand very quickly and much more easily. Notebooks where they can use their own terminologies to kind of keep information close by. Different assistive technologies such as text-to-speech and vice versa. The use of subtitles and things like coloured overlays. Dictaphones and other recording software, grammar and spelling software, and also things such as spell check, all available that students may use to help them with some of those challenges. Noise cancelling headphones. Again, Emily, you might want to speak a little bit more about this. Is something that you choose to do?
Yeah, so noise cancelling headphones are something that are particularly useful to me, and I tend to wear them a lot of the time. So if you come and join Middlesex and you're around me, you'll see that I often have my noise cancelling headphones around me. There's often been quite a lot of stigma attached to wearing noise cancelling headphones, because people think that you can't actually hear what they're saying or that you're being rude. But actually for me, it helps me to focus better, because I'm able to take in just the information that I need and not all of the background noise that really, really bothers me. So for some people, noise cancelling headphones are an absolute lifeline and are really, really necessary. So that could be something that some people might want to consider, or if you have some colleagues who are wearing noise cancelling headphones for that reason, then that might also be something that you want to take into consideration.
Yeah, absolutely. And I think from my perspective, it's something that is quite new to me. In the past, you know, seeing people wearing headphones, you assume it's to hear things like music or to listen to something, where noise cancelling headphones obviously have a different role to play. And actually just being aware of that, being mindful of that when you know, in the classroom environment, for example. So yeah, support networks. Again, Emily's going to tell you a little bit more about what we have from a university perspective in a short while, but just to kind of look at the immediate support network you'll have as a student at the university. So every student is given a personal tutor, which you work very closely with on a sort of a one-to-one level in order to kind of gain support from a sort of personal basis, and they will oversee your student career sort of from start to finish. There'll be, like I said, supervisors out in the practice setting. There are also, like I say, through the university, we've got the LET team, they're called the Learning Enhancement Team, who are available not only to students with an identified disability, but to all students that actually will be able to support things like academic writing and even sort of exam preparation techniques, you know, being able to look at overcoming nerves in difficult situations. And that may stem to things like the practice setting as well. Like I say, the clinical practice facilitators are clinicians out in the practice area that are based in the practice area, work very closely with the academic staff at the university, particularly link lecturers. So, for example, I link to Barnet Hospital, and Emily links to Queen's, so we'll be able to liaise very closely with the clinical practice facilitators in those trusts in order to sort of oversee all students, but particularly, you know, if there are specific learning strategies, learning plans that need to be put in place to support students, we can try and facilitate that as best as possible. Next slide, please, Emily. Lovely. Excuse me. So in healthcare, we know that neurodivergent people are often placed in people-centered roles. A lot of people with, like I say, neurodivergencies will come into healthcare roles, possibly because there's evidence to suggest that they may possess a high level of empathy. I know that a lot of students will have very much holistic thinking and problem-solving skills. So, for example, some of the students that I interviewed within my study, they were able to, some of them found that practice could be a strength, although it was potentially quite challenging for some of them in some respects, such as documentation. They were also found that they may be able to overcome problems that others may not necessarily be able to do, such as very practical things like how to support a woman to mobilise around a delivery room whilst hooked up to drips and having CTG machines, for example, attached to them, and they were able to maybe solve problems that others couldn't. Like I say, practice can be a strength. I say it can be a strength. It's again very much an individual thing to look at. Some people find that they feel very strong in practice, whereas others find that may be an area of that can be quite challenging to them. And when we say practice, obviously there's different areas of practice that they may feel more comfortable with, and other areas which may be more of a challenge. And it's important to note where the strengths are, where the challenges are, and again, kind of disclosing that to those in supportive roles around you in order to be able to look at ways in order to overcome them and actually play to your strengths as well. Lovely. So we spoke a little bit about the personal tutor, but just to kind of look at the personal tutor role in a little bit more depth. So the personal tutor really is your first point of call. They're the person within the programme that are going to be that constant. They're going to be able to get to know you on an individual level, and with discussion and support from other areas such as other parts of the university, and like I say, liaising with the practice partners, we're able to kind of look at a personalised plan of support for you, and that is integrated into the teaching programme. So for example, we're able to kind of look at ways in not only in the practice area but in it also within the theoretical side of the programme, in order to give you things like extra time for exams where necessary, and ensure that that's all put in place. Lovely. So I'll pass you back over to Emily, who will talk about some of the recommendations.
Okay, so moving forwards, what can you do concretely if this concerns you, if this is something that you're maybe worried about, or if you do have a form of neurodiversity and you think that you may need some additional support, what can you do moving forwards? Okay, so what you need to know is that Middlesex University has a disability and dyslexia service, and it is a really, really strong service. They're very experienced, and they're really very, very good at what they do. So I highly recommend that if this is something that you are concerned with, or maybe if you meet a peer on a course who you think might need some additional support and they don't know about this, make sure that you talk to them about the disability and dyslexia support kind of people at the university. Now, what can they offer? The Disability and Dyslexia Service arrange reasonable adjustments for students who are affected by health conditions or specific learning difficulties, and they ensure that things like teaching and assessment and that the campus are all accessible, and that disabled students ultimately have an equal opportunity to achieve. So for students who think that they might have an undiagnosed specific learning difficulties such as dyslexia or dyspraxia or ADHD, they actually offer a screening and an external referral for a full diagnostic assessment. So that's something to bear in mind. They also arrange things like academic support and adjustments for students who might have a disability or a long-term health condition where it impacts their ability to study. And these adjustments can include things like exam adjustments, in-class adjustments, information that can be shared with, for example, personal tutors and things like that with consent. None of this information is ever shared unless you consent to it being shared. That's really, really important for you to know. And it will only be shared with the people that you want it to be shared with. You can also have reasonable adjustments such as one-to-one support, ensuring that teaching areas are accessible, providing learning materials in the appropriate format. You can also get things like library support, and that includes longer loans, for example, for library materials. So as you can see, there's a really wide range of reasonable adjustments that could potentially be put in place. And this is not an exhaustive list. There are other potentials as well, depending on your circumstances. But ultimately, all of these adjustments will be summarized in what's called a learning support form. And then that will be sent to the student and they sign it. And it can also potentially be sent to the academics who teach them, but obviously, again, only with consent. So if you want any more information about that, you can go and look on the web pages for the Disability and Dyslexia Support at Middlesex University. And I've also, on the next page, I have put some contacts for you. If you feel like this is something that you need to address quite rapidly, then I would encourage you to contact either by email or by telephone. One of these, you can contact the team. Now, something that's really important to realise is that arranging disability support takes time. And if you're really proactive about carrying out the parts of the process that are linked to gaining disability support, it can still be a really long process for all of the elements of support to be put in place. So I really recommend for you to do this sooner rather than later, because ultimately what you need is for all of these things to be put in place as soon as the program's ready to go, because then you can hit the ground running. If you wait a few weeks or a few months and you've already had some time on the program, then you're not getting the support that you deserve and that you're entitled to. So I hope that you do feel safe and secure enough to be able to disclose it and to be able to get the support that you need. So I'll just end on the fact that Middlesex University has a really strong student group kind of presence. So the student union is very proactive in what they do, and we're very fortunate to have a disability network and also an MDX student union disabled students group. So these are things that you may want to join and be a part of and build your community in a different way. So this is something
I think it's important to note that you can join as an ally as well as if you identify as a student with either a disability, etc. So, you know, I'm part of the disability network. I don't myself identify as a neurodivergency, but I do support and want to enable others to progress. So that's one of the reasons why I choose to be a part of that.
Yeah, I think that's absolutely right. It isn't just made up of disabled or neurodivergent students, it's made up of allies as well. And I think that that's really important to build up that allyship as well. And if I look at the responses from the survey earlier, actually, you know, 3 in 4 people who've attended today do not identify as neurodivergent. So already that means, you know, just from having come to listen today is that you are moving towards allyship. And I think that that's really important. So that is it for the presentation today. We'd be really happy to take any questions that you might have. There's a Q&A function where you can type your questions or you can eventually, I think Charmine, who is here facilitating today, has said that you can also put your hand up and ask any questions that you might have. She can enable that. So it's completely up to you. But if you have any questions for us, please do go ahead and put some questions in the Q&A.
We'll just give that a couple of minutes to see if any come through. Ah, there we go. We've got a question there from ESRA saying, I can't remember if you already said, but would neurotypical be the correct word to use?
Yeah, so if you don't identify as neurodivergent, then you would probably identify as neurotypical. That would probably be the word I would use. But ultimately, I think it's down to each and every one of us to determine the words that we use. I certainly term myself as neurodivergent, and I'm very happy to say that I'm autistic, but other people might not be so comfortable with those terms. I would say that globally, yeah, and if I look at things like disability Twitter, autistic Twitter, etc., the terms seem to be neurotypical or neurodivergent. Are there any other questions?
I think we have a raised hand by, is it Lee or Lay? Sorry to pronounce your name if I'm wrong. You have a raised hand. I will allow you to talk, and you can speak directly with Amy and Emily here today. You're on mute, I think, Lee.
If you want to unmute yourself. I'm not sure if that's working.
Oh. Hello, can you hear me now?
Yes, we can.
Can you hear me?
Yes, we can hear you. What's your question?
My question is that I suffer from dyslexia, but they have been diagnosed last year, but I have things put in place for my previous course I'm doing. So I just wonder whether I can just take that diagnosis with me in Middlesex.
Yeah, you absolutely can. So all you'll need to do is go to the Disability and Dyslexia Services and provide all of your paperwork, and they will sit down and they will do a learning support form with you to ensure that you're supported. But I really recommend that you do it as soon as possible.
So I don't have to do another one?
No, if you've already had an official diagnosis, you shouldn't have to do another one.
Okay, because it was last year, May.
Yeah, it should be fine. But you need to talk to the services in order to make sure that you have got all the paperwork that they need.
Okay, thank you.
My pleasure.
Starting point, and as Emily says, the sooner you can get that ball rolling, the better it will be in terms of getting things put in place sooner rather than later.
Okay, so when I go for placement, do we have to support me because of the dyslexia?
In placement?
Yeah.
Yeah, so I think the most important thing is also to talk to the placement areas if you feel comfortable doing so. You'll have a CPF, which is a clinical practice facilitator, and if you disclose to them, then they should also be able to support you. And you'll also have linked lecturers, so between the university and the practice area, and there should be support put in place for you.
All right then, thank you.
And I think, as you said, Emily, earlier, it's not a given that information will reach the practice area without your consent. So like we say, we would encourage you to share that information, because if that information is shared, we can do more about speaking to the right people in order to put that support in place where necessary.
Well, definitely I will share it to people, because if I don't share it, I won't get the help. So it's not anything I have to have a stigma about it. It's just
correct.
So yeah.
And we were saying earlier, actually, weren't we, Emily, that even now, I mean, from the study I did, a lot of those students are now already qualified midwives, and that would have been going on for many years in terms of midwives coming through our system and going on to qualification. So there will be midwives out there with things like dyslexia, other neurodiversities, that will be able to talk to you about how they overcome some of the challenges, things that they do in order to support themselves. So, it's good to share that information really in order to develop and use that as a learning tool, really.
All right then. Thank you.
Thank you. So I just wanted to answer Ezra Lee's question here that's in the chat. So you say that you also work with some under 16s with autism, ADHD, etc., and that a lot of them feel that higher education is not for them. And how would you go about encouraging them? I think That's a really, really difficult question, because I think that a lot of people who are neurodivergent have previously experienced really, really challenging conditions, and they haven't necessarily thrived within those conditions and haven't necessarily gained the support that they need. I think the way that you can encourage them is by explaining that you know, there is more and more awareness today, and that universities, in particular Middlesex University, have a very, very strong sense of ensuring that everything that we do is accessible. We get training and we raise awareness. You know, I spend a lot of time raising awareness with regards to this, to make sure that students do get the support that they need. So I think it's about realizing that, yes, there are barriers, but people who have autism, who are autistic, who have ADHD, are have many, many strengths as well, and that these strengths can be exploited. So I think that that's something that you can talk to them about, and show them, you know, that there are different services, that there are networks, that there are, you know, places that they can join and feel a part of, as well as part of a wider community. I hope that that answers your question, Ezra.
We've got a couple more questions.
Christiana, so what support do you have for students that are clinically extremely vulnerable? I'm not quite sure what you mean by that. Do you mean who might have other kind of associated illnesses? When you say clinically extremely vulnerable, I'm not quite sure what you mean. Could you maybe just expand a tiny bit more in the chat, and I'm very, very happy to answer that question a little bit further. You say yes. So do you mean who maybe have like a poor immune system or things like that? Okay, so I think that your question links back to things like with COVID and things like that. I'm not sure if it does, but I think a lot of our students who were on the course with COVID found themselves in a situation where they were maybe having to shield because they were clinically vulnerable. And I would say, unfortunately, the thing that you do need to consider is, if you're going to be having a placement in a hospital, that you need to consider if your own circumstances are appropriate for being in hospital if you are clinically vulnerable with a very low immune system, because ultimately a hospital might not be the right place for you, or you might not feel comfortable being in hospital. I guess the thing that you need to know is that in hospital everybody is still wearing masks. That's something that's a really, really important thing to consider, that a lot of people are now vaccinated. So those are maybe things that you need to consider as a kind of a personal, you know, your personal circumstances. What do we do to support people who are clinically vulnerable? I mean, ultimately, we are always a listening ear. We're always very, very happy to discuss the person's circumstances, but in order to qualify as a nurse or midwife, you do need to complete a certain number of practice hours. So this is something that you need to think about, you know, with your own personal circumstances. Is there anything that you'd like to add to that, Amy?
No, I think that unless Christiana wants to add anything more to the question, but I think that's covered it. I'd like to just comment on Claudia's question. She's saying her place on the course has not been confirmed yet, as the university have asked for more evidence. So her question is, does she have to wait for a place to be confirmed to start the process to get support with dyslexia? So the answer is, well, I would start that ball rolling. Even, you know, if you're planning to start at the university, I would still contact the team in order to kind of get that advice with regards to when they would need that information. Again, it depends on kind of where you are in whether you've had a diagnosis or not. It may be that once you start the course, they'll be able to start that process with regards to diagnosis, but there may be things they can start doing before. I'm not 100% sure, but I would certainly suggest that you give them a ring and have that conversation, because if there are things you can do at this point, like we've said, definitely do it sooner rather than later. Anything you want to add, Emily?
No, I think that that's absolutely fair. I would certainly recommend doing that sooner rather than later. It is a process that can take time, as we've said, and I think, you know, to make sure that you do have everything in place as soon as the course starts, it's better to start as soon as possible.
Definitely.
Okay, so I think that we've answered all of the questions that were here. Okay, if there are no further questions, I think that we will end the webinar on that note. So thank you all very, very much for coming, and thank you for interacting with us. I hope that you learned a little bit more about neurodiversity in higher education, for those of you who didn't know too much about it. And I look forward to seeing some of you on the course maybe.
Thank you, everyone.